Uh, Good morning, all. The next case is a 53-year-old male with complaints of swelling in front of neck for 5 years, gradually increasing in size. He had history of joint pain and generalized body ache since 4 years. No history of dyspnea, dysphagia, or dysphonia. No history suggestive of hyper or hyperthyroidism. He also had recurrent episodes of pain abdomen since July 2024 that was severe in intensity, radiating to back, and associated with abdominal distension and constipation. Patient initially consulted medical gastroenterology for pain abdomen, and he was diagnosed with acute on chronic pancreatitis. On routine investigations, he was found to be hypercalcemia, hence he was referred to us. On examination, a 8 into 6 centimeter firm nodule was palpable in right lobe of thyroid that moved with deglutition, had smooth surface, and all borders were palpable. Trachea was central, no cervical lymph nodes were palpable. Per abdomen examination, abdomen was distended. Tenderness was present over epigastrium and umbilical region, but there was no guarding or rigidity. Bowel sounds were present. So the differential diagnosis of right solitary thyroid nodule with hyperparathyroidism and parathyroid adenoma were made. On biochemical investigation, his PTH was found to be elevated and his serum calcium levels were also elevated. Total calcium was 12 and the ionic was 6.1. CCT abdomen showed bulky pancreas with inhomogeneous parenchyma with multiple necrotic hypodense areas involving head and body of pancreas that was suggestive of acute and chronic pancreatitis. Ultrasound tech was done that showed a 8.7 into 8.2 into 5.1 centimeter anechoic cystic wider than taller Tyrus 2 lesion with a solid component of 8.5 into 7.9 into 9.7 mm. Left lobe and isthmus were normal. FNAC done from the neck mass was non-diagnostic. MIBI was done. So MIBI showed a avid nodular lesion infralateral to right lobe of thyroid suggestive of parathyroid adenoma. Along with that, there was a large photopenic area in the right lobe of thyroid. These are his MIBI images. This shows a uptake in the right inferior parathyroid gland, and along with that, there is a photopenic area. This is the normal right lobe of the thyroid. So coming to the management, based on the history of swelling in front of neck and recurrent episodes of pain abdomen and routine investigations suggestive of hypercalcemia and pancreatitis, PTH was done, which was found to be elevated, and MIBI suggested right inferior parathyroid adenoma with photopenic area in right lobe of thyroid. Hence, a plan of right hemithyroidectomy with right inferior parathyroid adenoma excision was done. So intraoperatively, the right lobe was found to be 3 cross 3 cross 2 centimeter. Along with that, there was a parathyroid cyst of size 6 cross 6 centimeter. Fluid was aspirated from the cyst that was golden yellow in color, and approximately 80 ml of fluid was aspirated. Post-operatively, the fluid was sent for PTH analysis, and the PTH analysis of the fluid was found to be 1,18,000. Post-operatively, the PTH level also fell. At 5 minutes post-excision, it was 124, and 10 minutes post-excision, it was 61.4. And on post-operative day 1, his PTH was 3.2. His calcium levels also fell post-operatively from 12 to 10.6, and on post-op day 4 it was 8.7, and on post of day 5, it was 9.1. On histopathology, the thyroid lobe showed thyroid follicles filled with colloid, and the parathyroid cyst, the wall of the parathyroid cyst had chief cells, was lined with chief cells, and it was suggestive of parathyroid adenoma with cyst formation. So coming to review of literature, parathyroid cysts are rare, typically comprising less than 0.5% of parathyroid pathologies and 1 to 5% of neck masses. This cyst may be functional, causing primary hyperparathyroidism, or non-functional, remaining asymptomatic until detected incidentally. Functional cysts comprising 10 to 15% of cases are more likely to present as solitary thyroid nodules due to their larger size and palpable nature. Functional cysts are lined by PTH secreting chief cells. Cyst fluid PTH levels more than 1000 picogram per liter being diagnostic, with reported values of PTH levels up to 74 lakhs picogram per ml. Thank you.